Hello, everybody. I am Tiffany Patton. I'm the Director of Behavioral Health, and I oversee part of our clinical team here at CCANY. I see people sitting up closer. Can everybody hear me? Do I need to get a little louder? All right, awesome. Thank you so much. So, I oversee part of our clinical team here, and they are behavioral specialists, and they are clinical specialists. Some of them are licensed, some of them are not. And we also have another part of our clinical team, which is the nursing part of that, and they are overseen by the director of nursing, and she will be doing some presentations later on this year, I hear. So stay tuned for that, everybody. Today, I am just going to talk to you a little bit about how to navigate some of the other services that are out in the community that are available to everybody in the community, including all of the folks that we serve here at CCANY, ACA, and LifePlan. So with that, I'm just going to go ahead and start that up, and I think it's going to share the slides for me.
How's that look for you?
Looks good on my end.
All right.
Next slide, please. So before we get started, there is a little disclaimer. So it is really important to remember that not all of the services that I'm going to discuss today in this webinar are going to be available to every member that we serve. Services can vary from county to county as well as agency to agency. There's eligibility criteria and things like that that go into each one. So it's not going to be for everybody. This is for informational purposes only. And if you need more detailed information or person-centered information, we would definitely encourage you to seek that assistance from your assigned care manager. Next slide. You can go to the next slide. Most of the services that I'll discuss today are under the auspices of the Department of Health, DOH, and OMH, the Office of Mental Health. So you'll hear me say those things a lot throughout the rest of this presentation. So under OMH services, some of what you will find here, the ones with the asterisks, I'd like to point out first, those would require the member to give up their OPWDD services. And they would have to be fully transitioned under OMH to receive any of those services with the asterisks. All of the ones that do not have an asterisk that we will talk about today, those are open to everybody, and you can be a part of OPWDD services and also receive some of those services as well. And they would not interact with each, or they would not discourage interaction with one another. So starting out, we have certified residential, which is similar to IRAs on the OPWDD side. Under OMH, they start out at a congregate care level, which is a group home, very similar to an IRA. They would have their own bedrooms. They would share all of the common spaces, and staff would be on site 24 hours a day. And then they would also have congregate care apartment treatment programs, which is kind of the next step up from that, where folks would live in the community in their own apartments. They could live on site where there's still staff available 24 hours a day, but they wouldn't be necessarily in a group home. They would still have like their own apartment on site somewhere. Then there's some other residential opportunities that OMH also provides. You'll hear a lot of acronyms. ESHI is one of them. That stands for Empire Supportive, and I said it wrong already, Empire State Supportive Housing Initiative. So under that initiative, there are a lot of different grant programs. I could never even begin to tell you all of them, but there are services that are specific to individuals who are just coming out of jail and are looking to get back into the community. There are specific services for folks who have HIV, the elderly population and aging population who are 55 and over, physically disabled individuals, domestic violence individuals. There are a lot of different grants, and they really touch all different groups. OMH has some specific services as well, and they touch all of those groups, but the common denominator is also that you have to have a mental health diagnosis. That usually is your primary diagnosis. Under those programs, they also have transitional living programs and then scattered sites programs. And those are similar to just a stipend program that you would even get under OPWDD. This is just given out by OMH. That's really the only difference. In those programs, they're the most level of independence. So those folks would live in the community with very minimal oversight from staff, maybe a once a month in-person visit. They would have staff available during business hours. If they needed somebody, they could call somebody. But for the most part, they're very independent. They are usually working to pay a portion of their rent, their grocery shopping, doing all of the normal things, and they have their other services. But from the housing point, they wouldn't have much services, just the stipend. There's also health home care management available on the OMH side. And that we talk about that here simply because this is families and members. So even the members that we serve, sometimes they have family members who may be in need of an OMH care manager, or they could use some assistance on that side, or they have some other family members or friends that could be of that service. So we talk about that here as well. The next 4 services, these are the 4 services that we'll discuss later on. I'll show a slide for each one and give you more in-depth information on them. But these are all services that are available to everybody throughout the community and all of the folks that we serve, depending on their individual eligibility requirements. But their status as an OPWDD client would not interfere with any of these services. Next slide, please. So what is SPOA? SPOA is the single point of access. That is what SPOA stands for. And really, it's just a fancy way of saying it's one application for several Department of Health and OMH services. So under the SPOA application is where you would find the boxes to apply for those certified residential, AOT, which we'll talk about in a little while, health home care management, and also ACT services, which is specific to OMH, and you would have to have an OMH diagnosis for those services. So all of those are on one application. Many of those services can be used to support people who have a mental or behavioral health diagnosis. And there's also a children's SPOA. They are separate. So there's a SPOA for adults and a SPOA for children. The children's SPOA typically services folks up to the age of 18, but depending from county to county, there are also going to be some services that are available that go to the age of 21. So one person might actually be able to fill out a children's SPOA for certain services and a regular SPOA application for other services if they were qualified for those. Specifically, as a side note for anybody visiting us today from the New York City area, for those that live in the 5 boroughs, you have one single point of access that services all 5 boroughs down there. And there is the website and the phone number right here for you. These slides will be available to you later on. As she said, that she will send them out. So everybody will be able to have these resources. And you will be able to click on any of the links that are in. Next slide, please. Okay, so the first program under OMH that we're going to talk about is AOT, Assisted Outpatient Treatment. This came about when Kendra's Law was passed many years ago, and it is a court-ordered outpatient treatment for individuals with mental illness living in the community. That is imperative. Their primary diagnosis has to be mental health. So when somebody goes to AOT, this is a person who's living in the community. They have to be 18 years of age or older. They have a history of not complying with treatment, not going to the doctors, not taking their medication as prescribed, maybe taking on a lot of risk and practicing a lot of risky behavior because they're not compliant with treatment. They're unlikely to voluntarily participate in treatment in the community. They're unlikely to show up to their doctor's appointments, not getting in a Medicaid cab, or just not going, not making the appointments, anything of that nature due to the mental illness. They are going to be very, very strict about that. They have to be at risk of relapse or deterioration, which could potentially cause them harm. And it could be a harm to other people. It has to be significant. they have to be likely to benefit from outpatient treatment. So what that means is when on the referral form, they'll ask a lot of questions, but when they get interviewed and when you go in front of the AOT staff, they would ask a lot of questions and they would do a lot of digging, get a lot of documentation to really be able to support that this person would have to be significantly different if they were to follow through with treatment, if they were following through with any recommendations or medications that they were recommended to take, if they could show that that person is significantly different when they're doing that than they are now, they'd have a better shot at being able to get AOT. AOT is court ordered, so a judge must order this. It can't just be a physician. It's not a voluntary service that you can just go in and ask for. So services can include, if they get AOT, case management, medication assistance, drug testing, educational and vocational training, group therapy, substance abuse treatment, counseling, supervision, assistance with living arrangements. All of those things fall under AOT, which is why it's got such stringent criteria to get in. OPWDD eligibility does not make a person ineligible for AOT. People with OPWDD are just as eligible as anybody else. AOT is difficult to get for every population because it really has to be somebody who cannot follow through with treatment. It's been shown they've gone through a history of really different approaches, different ways to get them involved in treatment, home treatment, things like that. If they really have a long history of that mental illness, then they can show this. It's possible. This starts with a petition to the court. It usually goes through with a signed affidavit by a physician. So this is not something that your care manager can assist with. They cannot refer you to this service simply because it is a limitation of rights. At the end of the day, if somebody is put on an AOT through a court order, they are voluntarily participating in this program, but it would be a limitation of rights. So care management cannot help you apply for this. This is something you'd have to do on your own. Next slide, please. Peer services. Peer services are typically embedded into specific provider services, but they can also be standalone. What the peer services means is that it's a person with lived experience. So that changes from program to program, in agency to agency. Some programs are in the medical field. They have peer services. So they would have somebody maybe that has a substance abuse history or a mental health history, could be an IDD history, any diagnosis. Some of them have chronic medical conditions, diabetes, things like that they have lived with and have become a peer in some program or agency in the community. Some of those services, they can assist with basic needs such as housing, food, clothing, transportation, legal assistance, governmental services, income support and employment, community engagement, and health support and services. In order to find the correct services for your needs, I did post a link on here. It's the Program Empowerment Services and Peer Supports. That link will take you to a larger web page where you can put in your zip code and your personal information, and they can help you find a program that's more associated to what you are looking for. Next slide. Crisis services. I know that this is a big one for everybody. There are a few options that are available in the community for crisis services. These, remember, none of these services will interfere with OPWDD services, and none of these are offered through OPWDD. These are all DOH, OASIS, and OMH programs. So there are the Crisis Stabilization Center. It's a supportive and intensive crisis stabilization center. These are available only currently in 2 counties. One is here in Onondaga County, and then there is one in Dutchess County. I will give you the exact information a couple slides from now. Those crisis stabilization centers are duly certified by OASIS with OMH and DOH. So they offer a lot of services under that umbrella that span substance abuse, mental health, IDD, not specific IDD, but almost all behavioral health supportive services are under that umbrella. CPEP is a comprehensive psychiatric emergency program. We have them here in our local hospital. I know that they are in certain local hospitals throughout our state. Not every county has one. That is typically the emergency room for any mental illness that's happening in your life. There's a short-term crisis respite. Short-term crisis respites on the OMH side are very different. You do not have to be enrolled to use these programs. There's no like enrollment or anything like that. These programs are just available if there's a bed available. They are first come, first serve throughout these programs. So they are available in all different counties throughout the state. As I said, there are websites and you can look them up. They are available. You can Google them as well. Most of them will come up if you Google those. You can, and I'll give you some more stuff in just a second, some more resources to look at where you could find those. Mobile crisis. Mobile crisis is exactly what it sounds like. It's a crisis service where you can call them. It is separate from 988. In some counties throughout the state, they are associated with CPEPs. They are associated with the crisis stabilization centers and certain providers in the regions. So in my region here in Onondaga County area, Liberty Resources offers a mobile crisis service, and that spans the 5 counties around Onondaga as well. So like Oswego County, Cortland County, Cayuga County, Onondaga County, Herkimer County, and a couple of others. So they are pretty large. So there's a couple I know in the boroughs as well. They might call them something different than mobile crisis. Sometimes they come in as a transition team or a HIT team, CIT teams. They're called a lot of different things, but mobile crisis can be called, and oftentimes they will handle it over the phone. Sometimes they can come right out to the site wherever you are and meet you there. It will be a peer and or a counselor, depending on what it is that you need. Sometimes law enforcement does come with them if there's a need for that, but that is not always a thing. 988 is an option for everybody. 988 it's a nationwide number. You can call it from anywhere and you can call it from any phone. It's just like 911. So even if you're in a place where you don't have service, you can call 911. 988 is the same way. 988 is the number that you should be calling if you're needing help with a mental health crisis or a substance use crisis. You or anybody that you know, or you see somebody in crisis, you can call 988. Typically, there's law enforcement also with crisis available in that same call when you call 988 if that's needed. You can text 988 as well if you're in a crisis. If you just want to talk, if you just need a counselor and you just got some things to talk about, you can text 988. You can also chat online. If you don't want to talk physically to somebody, you can chat online with them, end the conversation whenever you want. It's 100% voluntary and there for your assistance. 211 is a great resource. It is available throughout the state. You can call, text, or go online for 211 as well. 211 is specific to your area. So if you use online, you can go in there, you can put in your zip code or your information, and you can look up anything you want in there, any service from house cleaning to plumbers to community hab workers. You can look up any service that you could possibly need. It's in 211. They will give you information about that service. They will help you fill out a referral if you need one. Sometimes if there's links in there, it will give you phone numbers, addresses, any of the information that you need for that. You can call them and talk to somebody. They can look up to help you to figure out what it is that you're looking for. If you don't exactly know, they can try to help you navigate that. So it's a great resource. And then there's the crisis text line. You can text this 24 hours a day. All you got to do is just text it, got 5, and somebody will immediately text you back. It's a crisis counselor. They're there, they're trained, and they don't need to know anything about you other than what it is that you want to talk about today. And they will help you through whatever crisis you're going through at the moment. So if you ever need that, text got 5 to 741-741, and they'll be there to talk to you. Next slide. Okay, in Article 31, Community Mental Health Center. similar to an Article 16. So it's a good alternative. An Article 16 clinic, as you know, is specifically under the IDD umbrella. So an Article 31 is under the OMH umbrella. They are licensed by OMH and they are audited by OMH. So the individuals that go to an Article 31 mental health clinic are receiving mental health diagnosis. They can enroll in treatment services there. They don't need to have a pre-existing diagnosis. They can get an initial mental health assessment there. They bill Medicaid directly, so you don't need to worry about insurance. They also may take other insurance outside of Medicaid because it's an Article 31 clinic. It's open to the community for all mental health needs. So folks with private insurance or commercial insurance, managed care outside of Medicaid, they will take all of that. It is a good alternative, like I said, to an Article 16 clinic for mental health treatment, and they may offer some therapy groups as well. And it's really dependent from county to county. The person cannot be receiving the same service from another clinic, as that would be a duplication of services. That does not mean that they're not able to receive both. If somebody is receiving services from an Article 31 clinic, they just can't be receiving the exact same service. So for instance, they're receiving outpatient treatment for mental health with a therapist somewhere else at their Article 16 clinic. They may join a therapy group or something like that the therapist recommends at this Article 31 clinic, but they would not be able to receive those same therapy services. They would bill the same thing and those would not interact together. But if they were just doing the group there, they could bill for the group and then they would be able to bill for their therapy services at their other place. They would work that out. You would have to definitely talk to them, but it doesn't exclude them. And Article 31 is open to the community. Next slide, please. These were the crisis stabilization centers that I was telling you about earlier. So there are only two currently, as I said. The one is here in Onondaga County that's operated by Helio Health. It's open 24 hours a day. The idea behind a crisis stabilization center is that folks could go there when they are in crisis, to the point where they do not need to be in a CPEP or hospitalization. So they have to be able to be discharged within 23 hours and 59 minutes from a crisis stabilization center. Otherwise, they would necessarily go to CPEP. These crisis stabilization centers offer everything under their umbrellas. So they have psychiatric services, they have nurse practitioners, they have peer services, they have a place to relax. Like you can go, you can grab a sandwich, you can talk to somebody. There's all kinds of stuff there. You can get a medical exam, you can get a psychiatric evaluation. If there's a pickup order, if there's a mental health pickup order, the police and your doctor sign that, and they have to take you in. It's 942. It's the code for that. And if that happens here in Onondaga County and in Dutchess County, folks can opt to be taken to the crisis stabilization center rather than their local CPEP if they wanted to, and if the folks who are transporting them are so kind. So the one in Dutchess County also operates only in Dutchess County and the surrounding areas. Unfortunately, there are going to be some areas in New York State that these crisis stabilization centers do not touch yet. There is a plan in place for that to be expanded to 5 crisis stabilization centers. I am not sure what year they plan to be done with that or when the other 3 will be built, but these 2 are fully operational at the moment. Next slide, please. This slide and the next slide are the certified community behavioral health centers that are currently operational. They do have funding and plans to have approximately 31 of them throughout the state, so that it would obviously open up mental health care a lot in our state. However, currently there are only 13 that are operational, but they are operational and they touch almost every county from St. Lawrence all the way down throughout the 5 boroughs. They are all listed here. I am not going to read them all for you. I'm sure nobody needs that information. But the name of them, their addresses, the locations that they serve, some of them, the phone numbers, and then every one of them has a link. So you can go on, you can check out their information on their websites, you can check out all the services that they do offer. These certified community behavioral health centers are just like any other clinic. They offer a range of mental health and substance use services. They aim to improve access to care. That's why they're in the community. They want to be closer to where the people are that need them and cut down on the need for transportation and things like that. So they're really trying to expand services in the communities. There's only 13 available yet, but they are there if you need them. Next slide. The next slide is just another compilation of that list. There we go. This is the last service that I'll talk about is PROS, Personalized Recovery Oriented Services. This is really similar to DayHab for on the OPWDD side. So for OMH, they have this. They provide, in the past, they used to be like sheltered workshops where folks could go work and do things like that. And they kind of got away from that. And they now provide these services. So they vary from community to community and from agency to agency. But their overall premise is to provide services for folks who have a serious mental illness. When they say serious, that typically means an Axis 1. There's an eligibility criteria that would come with that. It's usually very serious, like schizophrenia, depression, things like that. It's not typically for folks with personality disorders, TBIs, or organic brain disorders. Those are not considered serious mental illness. They are mental illness, but it wouldn't compete for that eligibility. For these services, you can still have those diagnoses and you can still have an OPWDD diagnosis. That it doesn't take away from any of that, as long as you do meet the other criteria. They utilize a comprehensive model combining rehabilitation, treatment, support services. Most of the staff that you would find in a PROS in most agencies are peers. So they are people with lived experience, substance use, mental health, they're in recovery. And you will also find licensed staff that would provide the majority of these. In some PROS, which is a really great benefit, it's a shame it's not in all of them, but some of them have an on-site psychiatrist and an on-site nurse practitioner, and they do medication training. They actually hold people's medication and will help them every day do their medications. They really offer a lot of great services if that's something that somebody's interested in, and they're voluntary. You can sign up for them. You can go if you want. You cannot go if you don't want. It's not anything that people are going to hold you to the fire for. It's not set in stone. It's really nice and voluntary. Those services include some wellness, self-management, basic living skills, community living exploration, benefits and financial management, relapse prevention, all of the good stuff that goes along with psychoeducation and diagnosis and treatment. It is really focused on treatment. It is person-centered, so they really design your treatment program around you. When you go to a personalized recovery-oriented services program, you would have a person that would be assigned to you, go through like a life plan. It's something similar, but it's really designed on what you want, what you're looking for. A lot of them offer different groups on like a calendar basis, like schools, if you will, like you could pick courses to take or not take. And so they're all voluntary, and you can pick and choose what you would like and what you won't like. So it's really nice to explore. They also do like outings and things like that. So I know sometimes we have one up here. They go to like the Adirondacks every year and do like a camping trip for a week. I don't know what that's all about, but it sounds real fun. These are all things that are open to the community. Anybody who can meet these eligibility criteria, and they're not stringent for personalized recovery-oriented services. I implore you, please go look at that website, find a program if you're interested in it, and look it up, get some information on that. Next slide, please. This is another program that is definitely designed for kids, though. Children and Family Treatment and Support Services is another outpatient treatment. They come to the house. They bill Medicaid. They come to you. They serve children and or the caregivers. They don't just serve the caregivers. So they serve the children and the caregiver. It must be a child. It is for children and youth under 21 years old. They must have a mental health diagnosis and or substance abuse need. They provide support in the home and or the community. Like I said, it is individual family therapy. psychosocial rehab. They teach lots of skills, family peer support. They have youth peer support, crisis planning and intervention, coping skills, relationship building. They teach a lot of stuff. And it's really, again, it's designed about what you need and in your home and in your community and what's going to help you. It's not available for every single person. Again, they have their own eligibility requirements, but if it's something that could help you, definitely talk to your care manager or check out the OMH directory that is linked here, and you can find a place that you can get a referral. Anybody can refer this, so your care manager can help you with that if you did want to look into that. Next slide. I think that might be it. It's not. It is the last program, but I threw this in here. This is a community services and resources slide. And I really just want to throw this out here because many people overlook a lot of these services that are just available to everybody in our community. If you have Medicaid, you can get free non-emergency transportation to medical appointments in New York State through Medicaid transportation. The link is there. There's some steps you might have to go through to get that, to enroll in it. Your doctor might have to call. There's a lot of different eligibility requirements for different groups. But if you have Medicaid, that is available to you, no matter who you are, no matter what else you have. Food pantries, they're in every single community. There's a list here. The Department of Health monitors all of them. So if you are in need of food or you know somebody who is, food pantries are open to everybody. Again, every single person. Lifeline. These are just different things that are available to everybody that a lot of people don't know about. Lifeline is a discounted phone service. So you can actually get that on a landline or cell phones now. And it usually discounts your landline to like $20 a month. That's a max. It caps it at that so that you always have phone service. SNAP, obviously, that is through DSS. It is also known as food stamps, but that is available to everybody in the community based on your income level, not your disability. So again, check that out. Next slide. This is my final thought. So if there is no other service that is meeting the need and you need more comprehensive services, they do exist. They are out there. Have an individualized conversation with your care manager for more information. I really thank everybody here for their time and attention today. I will try to answer as many questions as I can. I hope that I have enough information for everybody. Again, this wasn't all the information out there possible. I'm not an expert. It changes from day to day and from county to county, unfortunately, under those services. But they are out there, and the links are great, and you can explore all of them, and there's a ton of information in each one of them. Thank you so much.